Hello everyone, my name is Medvis Jackson. I'm with Detroit Homecoming. As you know, our project is dedicated towards helping expats connect in a meaningful way with the city, allowing them to invest their social, human, and financial capital into the lives of Detroiters and into the city's infrastructure and programs. So today, we're here to talk about healthcare. As you know, healthcare and the healthcare industry is a huge multi-billion-dollar business in the United States. And we're here today with Mr. Shiraz Ahmed and Dr. Paul of Plum Health to kind of talk about what the landscape here is like in Detroit. More importantly, what is it like at the grassroots and ground level? And how do a lot of these trends and phenomena kind of affect the way that our city's overall well-being stands currently? So again, let you introduce yourselves and what you're doing in the healthcare space. I'll start with you, Shiraz.
Great. I'm Shiraz. I'm a filmmaker here in Detroit, making a documentary and photo storytelling project called Alive in Detroit, which follows the tale of people like Dr. Paul and patients in the city as they try to navigate the maze of healthcare and the health industry and just try to live.
Awesome. And you?
Yeah, my name is Dr. Paul Thomas. I'm a family physician, and I started a direct primary care service called Plum Health. And our mission is to make healthcare affordable and accessible for everyone in Detroit. And that's radical because it isn't affordable or accessible. And our office where we are right now is in a health professional shortage area, or an HPSA. That means there aren't enough family physicians or primary care docs to serve this community. And virtually all of Detroit outside of a few neighborhoods in downtown and midtown and New Center are HPSAs. So health professional shortage areas. So this is part of our mission, to be here on the ground level serving people in this capacity.
Awesome. What contributes to some of those lack and shortages of healthcare professionals?
Yeah, I think one of the biggest problems is that the way we bill for health insurance, we bill people with really good insurance plans, and those tend to be people who have more money, who are wealthier. And because a lot of those people live in suburban communities, the bulk of our healthcare infrastructure is centered around serving those people,
Gotcha.
Right? And so then if you're a big box hospital system in the region, you're looking at developing your primary care services or your big hospital in West Bloomfield or Grosse Pointe, because that's where your highest reimbursement is going to be for primary care services. And unfortunately, it leaves a lot of Detroiters underserved.
Yeah. And so, Shiraz, in your work in making this film Alive in Detroit, correct?
Yes.
What has your experience been in terms of, okay, so there's a lack and shortage of healthcare. How does that shortage of healthcare kind of affect people's perception of healthcare and medical treatment itself?
A lot of people view it, and it's pretty true, as this kind of Byzantine system where it's really hard to find a doctor, it's hard to get to the doctor, it's hard to keep up with your prescriptions, things like that. So I think people take what should be, staying healthy and living a healthy lifestyle should be something you do every day, but they view it as this kind of foreign complex that's so far removed from their everyday lives. Yeah. I was at a church in Brightmoor the other day on Saturday. They were doing this massive kind of food health drive around the holidays, and I was talking to this woman who was volunteering about my film. And I was talking about how there's this huge divide between the healthcare industry proper and then just actually doctors who are just trying to take care of people, right? And she was like, "Oh, it's all corrupt." Which, I mean, you hear that a lot,
nowadays,
whether it's true or not. Yeah, exactly. It's the impression people have.
Yeah. And so that causes them kind of disengaged from kind of looking after their personal health.
When really primary care physicians, people like Dr. Paul, are just people trying to help you out and not go broke while doing it.
And so, Dr. Paul, as you try to engage folks with their health, and how long have you been doing this for now?
Yes, I've been here for 2 years.
2 years, yeah, I've been doing it. And so, for one, explain to our expats, and I think some of them got to meet you at Homecoming this year and the year before, but for those who aren't aware of how unique your mode of service is, explain to them how you're treating folks, and then if you can, how that disengagement from healthcare, how challenging is that kind of barrier towards, hey, it's all corrupt, I don't understand it. I don't have access to a doctor, so it's not something I've gotten used to doing anyways. So in your work, explain what you do, but also kind of go into that barrier of getting people to understand, okay, you need to manage your own health?
Yeah, I think a lot of people in Detroit have given up on managing their own health and healthcare because of the cost. So the cutoff for Medicaid eligibility is $16,800 for an individual.
So after that point, you don't get coverage anymore?
Yeah, if you make more money than that.
$16,000.
Yeah, so it's very, very low. And a lot of people are surprised when they hear that because they just don't know. So let's say you make $24,000, which is a median income in Detroit. As an individual, at $24,000, you're not qualified for Medicaid, and then health insurance, depending on your age, might be $300 or $400 or $500 a month off of the exchange. And then even if you have that health insurance, it doesn't guarantee you access to a good doctor, and you still might have copays, etc., and that doesn't factor in prescription costs. So you're putting all these barriers between people and regular health care.
Yeah.
Right? And so this is why I'm so passionate about this model. I do a membership. It's $10 a month for kids. It starts at $50 a month for adults. When you're a member, you can come see me anytime in the office. No visit copays, no visit charges. And then we really try to lower the cost of those meds and labs and imaging services to make it really easy for people in this neighborhood, in our community, to manage their own health care.
Wow. That's so interesting. So if you have all these people not getting treatment, and you guys can both kind of jump in on this, what are some of the major ramifications that has for Detroit as a city in terms of, people's ability to show up to work reliably because of pursuit of health, and ability to be good parents, and to be just living a really robust life? Would you both mind going into that a little bit?
I can jump in on this one. I think just a really clear-cut example that everyone understands is asthma. And the asthma rates in the city of Detroit are 50% higher than the rest of Michigan. So the asthma rates for kids in Detroit is 15% about, and the asthma rates for other kids in Michigan is about 10%. So then if you look at that on the grand scheme of things, you have absenteeism from school because of asthma exacerbations. They got to go to the hospital because they might not have a primary care doctor in their neighborhood who could manage it with some albuterol. So then you're missing school, and then the costs are going up because you don't have access to reliable primary care. So you're using an emergency department visit for something that's not an emergency. And so you can kind of extrapolate from that a lot of the social problems that you can start to have because you're missing out some basic primary care services. There's some environmental things that may play into poorly controlled asthma or higher asthma rates, like incinerators or oil refineries that are in our neighborhoods, and how do we combat those? Yeah.
And from your experience, Shiraz, what do you think the ramifications are for a society that is so much of its population is disengaged from healthcare?
I think a lot of it's the mental anxiety and anguish that comes along with even just being uninsured, knowing that it's pretty infeasible to go see a doctor if you do become sick. I've had friends who are middle class, get laid off, right? Don't have any particular health issues because they're young, healthy people, but just having to figure out how to, what COBRA is, which is the insurance that you can get on if you get laid off or get fired, or how to get on Medicaid here at Healthy Michigan, which is a great program but has a lot of difficulty. Even in just getting to the office and getting the paperwork filled out. I feel like it causes people, it forces people to be distracted when they could be focusing their attention on being productive or fulfilling their life, right? You talk to people who have regular health conditions or just persistent pain, and it's like a daily mental activity to just get your drugs, get your healthy checkup, watch your nutrition, even just talk to a doctor.
So I'm going to give you a few scenarios of expats who might want to engage in this issue. First is, you're run-of-the-mill, interested, has awareness of how the medical system works, is interested in the issue, but they're thinking, I want to create a business in this space. Where can I, while also acknowledging the dignity of humans, I also want to make money in this space. Right. What would you say is like a population that you may not become like Amazon rich, but there's a service that needs to be provided, and from your perspectives, people still aren't tapping into that need? I'll let you go first, and we'll jump to Paul.
Right. Well, there's a lot of inefficiencies if you're looking for a business opportunity. There's a lot of inefficiencies in just healthcare administration. It's not the sexiest area. But things, I know there's a lot of startups working in the health records space, which you can, I mean, it wouldn't drag down the cost of healthcare, but if you can solve the issue, if you can just digitize our health records, keep them secure, make them portable so you can take them with you, make sure that your specialist isn't performing the exact same tests as your primary care physician did. Things like that, I feel like there's probably a lot of money to be made, especially if you get a government contract or something like that.
I would say health record interoperability. Right. It's like if you can get these records to talk to each other, that's kind of like the $1 billion prize. If you can figure that out, is going to be the next, Steve Jobs, Jeff Bezos.
And it'll improve the quality of life for folks.
Yeah, exactly. Because it's such a needed thing where you have all these proprietary healthcare records or medical records that are centered around billing and coding for a certain institution, and then you go to the other hospital system in the neighborhood and they're on a completely different record. So I've run into this challenge. So if one of my patients wants to access care, we have to spend like a month trying to get the records so we can actually take care of them in a meaningful way.
Wow.
So
that's a big one. Okay, so here's the expats and locals. All right, so the next expat is somebody who wants to do philanthropy. They want to whether it's putting in their human capital or the financial capital, and they just want a social return. They're not looking for a personal financial return, but they want a return for society to. Obviously, you can donate your money to a hospital, but what other ideas did you throw out there for expats?
I mean, I would say, if you really want to do a great service, would be build a primary care office in an underserved community. In Brightmoor, I was interviewed by Chad Livengood.
Okay, great,
and the Detroit Rising podcast. And in the article he wrote from that, I often say that there's one primary care doctor for every 6,300 residents in Detroit versus one primary care doctor for every 600 residents in like Ann Arbor or Oakland County.
Oh, wow.
Right, so it's like a 10x disparity.
Wow.
So he dug into this a little bit more. There's one primary care doctor for 30,000 residents in Brightmoor. 30,000. So if you want to talk to one of these big health system players and invest some money into primary care in Brightmoor or a neighborhood like that and have your name on it, that'd be amazing. Right? It would really, it might take $1 million to operate each year, and then
$100,000 from some people.
Yeah, exactly. So, and then you have some branded physicians working there.
Branded physicians.
Like with some of the big box hospital systems around town, like you could be.
That really improve quality of life.
Yeah, because it's so needed.
And it talks to the issue of also, and Dr. Paul talking about this, so he should be talking about it, but the cost of medical education. A lot of doctors, a lot of upcoming doctors don't go into family medicine because you come out with $500,000 of debt. You're going to go into the specialties where you can make more, so you can pay off all of that debt.
So we almost need like fellowships for doctors.
Exactly. If you can sponsor a position,
sponsor some medical students at Wayne State who are interested in primary care. To become those primary care docs with less of a debt load, so it's more appealing for them, right?
Very cool. Or sponsor some doctors to go to Cuba and come back and do that.
Right.
All right, and then the last expat is somebody who's like, well, I'm going to be home for Thanksgiving, or I'll be home next year for like a week or so. Is there anywhere I can visit or like volunteer for like a day or a couple of days? Are there any projects that you've seen around the city that there's any space for like that kind of like, they can do something, or
we're talking about non-health, non-medical person?
Non-medical person.
Okay. That's a good question. Most volunteer organizations I work with usually have physicians volunteering.
Okay.
But I mean, there's an organization I work with called Zaman International, which is out in like the Livonia area near the airport, where they have this massive warehouse that they bring in medical supplies and food and furniture and like wedding dresses, and then people in the community will help them deliver these things to people in the area, one of their official families. And that's something where it's, you just need kind of a human touch in a car.
Very cool. How about you?
Yeah, I mean, I think there's a ton of opportunities to volunteer around town from a medical perspective, like, let's say, Cass Clinic or the student-run free clinic on the east side. or Street Medicine Detroit, also a Wayne State program. You know, I'm a Wayne State trained physician, so these organizations are close to my heart. But even if you're not a doctor, maybe you could lend some support to them, either by helping them spruce up their website, or doing some consulting work for them, or doing some other pro bono services that could help the students care for more Detroiters who are underserved.
Very, very cool.
Yeah.
Awesome. Why did I guess I'll let you guys, as we start to close out here, I'll let you go into why you're doing what you're doing. Why did you choose this kind of this unbeaten path or underbeaten path of primary care, and why did you shoot a documentary on this when you were not a doctor and it's not something you thought about beforehand? So I'll let you go in and then I'll see what.
Sure. Yeah, so like for me, you know, I believe that healthcare should be affordable and accessible. You know, I've said that once, but that's, you know, my ethos. This is why I'm doing what I'm doing. And I also found this philosophy of Ikigai. If you want to check it out, it's really interesting. It talks about finding fulfillment, or like your reason for being. I knew that I was a good doctor, competent physician. I knew I could earn money doing it, and I would serve people, but it wasn't really fulfilling to be working in a fee-for-service system where you're not having enough time with your patients and really not giving your full skill set or your tools to people because you're limited by that time. So that's why I wanted to go into this model where I could serve people who were underserved, but also have the full amount of time to spend with my patients and deliver the best care possible.
Awesome. Thanks for sharing that. For you, why Live Detroit? What sparked this?
Well, for me, so I think it's, you know, people say healthcare is never anyone's issue until it's absolutely your issue. I think that was the situation with me where I was kind of a healthcare policy geek, where I like reading about all these issues because it's such a convoluted industry. But I never really interacted directly with the healthcare industry besides regular checkups until my mom was laid off in the recession and had to try and get insurance through the Affordable Care Act, which she's down in Texas, so there's all sorts of issues with Medicaid expansion and things. Very long story. Had a lot of hurdles to get through. She couldn't get insured. Ended up having to get a free triple bypass surgery up here in Michigan while she was uninsured. And basically my journey, this is like a 5-6 year journey, and just working with the Affordable Care Act, working with her, being on the phone like all the time with doctors and things like that, and just trying to figure out how she could just get some basic treatment. Really opened my eyes to not just the inefficiencies, but the real human cost. And that's why I wanted to make a film about it. And then I met this guy, and it kind of sparked my actual, like, buying the camera.
Just imagine like you dealt with that situation. Just imagine with somebody who had more social stress.
Right, yeah, exactly. Or somebody who just doesn't know how, like,
how to navigate.
Yeah, it's insane. I can't even imagine.
So I guess as we close out here, quick question. What do you all think on the whole idea of like our neighbors to the south of us, I guess in Windsor, and in other countries in Europe, they take more of a public medicine approach. Is it that inefficient that it's not feasible budget wise? Does no one really know yet? Would it kind of get people at least part of the way? Maybe it won't be the best form of healthcare, but it would get them some basic treatment or nutrition guidance and stuff like that.
Yeah, I think. Man, there's a
lot
huge
there.
issue. We could do a whole other episode. But I think having some basic insurance coverage for everyone would be wise.
Okay.
However, I believe in the free market, and ours is a free market service. You know, where people can shop around for the best services, and my members have found me because we provide excellent care at a lower cost than typical. So I really feel like if we want to innovate in the healthcare space, we have to have some free market room to do it.
Absolutely. Cool. So you're focused more on affordability versus universality of it.
Exactly.
And what about you?
I think there's a big role for the government to play, especially in negotiating prices to bring down. And that's what Canada does so well. Just bringing the whole cost curve down. In terms of actual governmental administration, I mean, we have that here in America with the VA, and it's not run entirely well. I'm not an expert in it, but there's a lot of issues. I think the role for government in this area is to set goals and help structure the market, because that's where you have a lot of the perversions and weird things happening with us.
Cost,
but not necessarily run the entire healthcare market, because a lot of it comes down to like what happens in this room. I guess I don't know if you can tell, but we're in Dr. Paul's office between a doctor and their patient, right? That's just kind of everyday stuff. And as Dr. Paul can talk to, it's a lot of it's investing in public parks and things like that.
Yeah, how big is nutrition and active lifestyles to health? I mean, obviously there's genetic stuff. And
you look at these studies where they say like the higher your individual education or your personal income, which are kind of have a linear arrangement sometimes, the longer you live and the healthier your life will be, right? So, how do we invest in public schools and access to parks and safe places for kids to play?
Fresh fruit and vegetables.
Yeah, access to markets and bike lanes and transportation options where people can get to these things, right? And you can kind of see some threads of that coming out, like Detroit started that bus program where they have specific buses.
Fresh wagon, right?
Eastern
Fresh
Market
wagon,
every
right,
Saturday.
Yeah.
And you're seeing
Shout
more
out on that.
more bike lanes. You're seeing more intentionality around public park design and trying to engage people in healthy activities and make it feel safe and get more families out there.
That's what's up. All right, well, I'll let you guys get off the political realm. Where can people find your work at? Website, social media?
I have a website up, alivedetroit.org, and on Facebook and Instagram with Alive in Detroit. That's a lot of the photos and videos taken so far.
And you're still in pre-production, so they have a lot to look forward to.
Yeah, exactly. I'm still fundraising and filming.
So if you want to make a difference,
yeah, right. It's a charity case right here.
And what about you, Dr. Paul?
Yeah, so we're at plumhealthdpc.com, and we're also on Facebook, Instagram, Twitter, and then I have some exciting news today. So
please release.
I just published a ebook about our practice philosophy, what direct primary care is, and how we're making a difference in Detroit, and that's on Amazon within the next few hours. It's at up to 72 hours, so it should be there sometime soon.
Breaking,
breaking some news.
Breaking some news. I like that. So thanks so much for joining us. I'll put their links in the comment section. Definitely engage these two individuals. They'll be able to connect you with other women and men who are pioneering and being brave on this front in Detroit. We want to have a healthy society and have healthy citizens in Detroit. So thanks so much for joining us, and look out for more content from Detroit Homecoming. Take care.